is here to here.
Okay.
The pharyngeal tonsil is here, otherwise known as the adenoids. The opening to the auditory tube here, opening into the nasopharynx.
Okay.
That's also called the eustachian tube.
Right, that's what I thought.
Or pharyngotympanic.
Okay, it doesn't matter.
Cavity
Doesn't matter what you call that, right?
Doesn't, yeah.
Either
Auditory tube or eustachian tube is good.
Okay.
Salpingopharyngeal fold. Now the muscle that goes from salpinx to the pharynx, that's a longitudinal muscle of the pharynx. It's an elevator of the pharynx. It's this fold right here. So that's mucosa covering a muscle that attaches to that cartilage piece, that torus tubarius.
Okay.
So that's the salpingo. Salpinx means tube, right? In Greek. So salpingopharyngeal fold.
Okay.
If you pull the mucosa, it's the muscle. The muscle is underneath, giving rise to the fold.
Okay.
Which is a longitudinal muscle of the pharynx, an elevator of the pharynx. It's in the notes.
Okay.
Okay. The pharyngeal recess is actually here. That's where the pharyngeal tonsil is.
Okay.
Right. So for the oropharynx, the lingual tonsil will be back here. All right. So that's just lymphoid tissue at the base of the tongue.
Okay.
The foramen cecum, you don't really have to worry about that too much, but it's interesting that there's a pit from the front part of the tongue and the back part. That's the foramen cecum.
Okay.
And actually the thyroid gland develops there and migrates through the neck to sit down here. So there's a path that the thyroid gland migrates, and it forms back here on the tongue. But
Okay.
sulcus terminalis. If we had the foramen cecum in the midline, there's a groove separating the back part of the tongue from the front. That's called the sulcus terminalis. It goes that side and this side.
Okay.
Laryngopharynx, from the epiglottis to the cricoid. All right, here's the cricoid. Right. So the laryngopharynx is here up to here, this level to this level.
Okay.
Of course, the larynx is in here. Right, so laryngopharynx is back here. The esophagus starts
At the
inferior border of the cricoid.
Okay.
The piriform recess, now that's better seen here. That's here. Right? So the food comes and is deflected by the epiglottis, right, covered with the mucosa. And let's see how it gets directed down. Remember, the pharynx is back here, behind the airway. So that's the piriform recess.
Does it get reflected down on both sides or just one?
Yep, both sides.
Oh, cool.
I'm showing it here because the mucosa is intact.
Okay.
And these are the intrinsic muscles of the larynx.
Right.
That move the cartilages, right? So that's all in here. So that's just with the mucosa taken off. But the mucosa would cover this, so the food and water go on either side.
Okay.
Okay, for the larynx, the aditus, or the inlet, is this opening here. So it's an oblique plane. There's the tip of the epiglottis, right? There's no mucosa here. There's mucosa here. Mucosa comes down. That's called the aryepiglottic fold, right? Because the arytenoid cartilages are down here.
Oh, right? That's where the arytenoid is.
That's these guys. And then the corniculates sit right on top, right? So these little bumps right here and here are these guys.
Are the corniculates?
Corniculates, yeah.
Okay.
Okay.
And the arytenoid is
the big one. Is
okay.
The whole big piece here.
Okay.
I mean, relatively big. They're small in actuality, but these are even smaller. These are tiny.
Okay.
In a person. Okay.
Yep.
Aryepiglottic folds would be the mucosa coming down here and here. Right? And then if you pass through that, that's the aditus, or the opening. So you're in the laryngopharynx, you're in the larynx, right? When you go through the aditus. Vestibular and vocal folds. I guess we have to open this up to show you that. So here's mucosa covering the inside of the larynx, right? And there's a space here that's called the ventricle. So that's the vestibular fold covered with mucosa. And that's the vocal fold. That's the true vocal cord down here.
Okay. Are those muscle fibers right there?
That's the vocalis muscle.
Okay.
Vocalis muscle. Because the vocal ligament and then the vocalis muscle make up the vocal
So
fold.
the vocal ligament
Vocal ligament.
kind of that separates the vocal folds from the vestibular folds.
Not exactly. If you were looking down like this, the vocal ligaments would be the two closest things coming together.
Okay.
All right?
Yeah.
So the vocal folds actually, ligaments, sorry. The vocal ligaments are the closest things that actually, when you close your airway, right, and hold your breath, if you will, the vocal ligaments come across, in contact with each other.
Okay.
When you hold your breath, right?
Yeah.
And then you open and obviously breathe and speak. Mm-hmm. Okay, so the vocalis muscle is actually off of the midline. It's actually farther that way. And
Okay.
this way.
Okay.
All right.
Yeah.
Okay. So ventricular region, that's inside between the true fold and the false fold, or the vestibular and the vocal fold. So that's the ventricular region.
So which is true and which is false?
True is here, false is here.
So the true are the vocal
So
folds.
the true is vocal, false is vestibular.
Okay.
Infraglottic region. The glottis is this horizontal plane, right, which is vocalis muscle, vocal ligament, and then the opening between them, which is various sizes. It could be all the way shut or it could be wide open. That's called the rima, R-I-M-A. That's the opening, all right, down into the subglottic or the infraglottic area.
Okay.
The rima is the opening between the vocal folds.
Okay.
Okay?
Yeah.
All right. The cartilages, so I can't really show the nerves. I could show some of the nerves. The cartilages, as we talked about, let's start here. Thyroid cartilage, cricoid, just to here, the complete ring, epiglottis, arytenoids, corniculate, the tips, and then you can't see the cuneiform, which would attach here and come up, right, like a golf club kind of looking thing. But you could see where the bump is. It's right here. Okay. So if we look on this, here's the epiglottis.
Right.
The corniculate is here, and then there's a bump midway between. That's actually deep to this mucosa, the corniculate.
Okay.
I'm sorry,
The
cuneiform.
Cuneiform.
The cuneiform.
Okay.
Okay, which kind of holds up that fold, that aryepiglottic fold, just so it doesn't collapse on itself. Kind of keeps it open.
Okay.
All right.
Yep. And
That's
I think that's it.
Okay.